Welcome to Medical Insight, a weekly healthcare feature brought to you by the experts at Essentia Health. Here's your host, Louis St. George.
Today on Medical Insight, Essentia Health orthopedic surgeon Jefferson Davis talks about treating troublesome feet and ankles, which could involve using a joint or complete reconstruction.
Obviously, we walk every day, and we're on our feet most of the days, most of us are, and a lot of these people have disabling pain that they just can't deal with. Our bodies aren't made to last forever. They wear out, tendons wear out, the tendons that hold up our arches wear out, our feet get flat, some with time. People have sporting injuries, twist their ankle, rupture their ligaments. Those sometimes need to be reconstructed. I see quite a few people for flat foot, progressive flat, their arch has fallen, they're having increasing pain. I see a lot of people for what they call Haglund's deformity, or a bump on their heel that's rubbing on their Achilles tendon and causing a lot of pain in their heel. I also see a lot of people for ligament instability of their ankle.
Dr. Davis says technology has made the procedures he performs much more precise.
They are computer guided in that we take a CT of the ankle before we do the ankle replacement. We send it away and they make specialized jigs that just fit onto that person's anatomy, and that enables us to put pins in exact places, take those jigs off and put on the regular cutting blocks that we cut the bone with, and it cuts it very precisely. It's better than anything when you have a patient that's happy and has had a good result, that there's no replacement for that. So yeah, that's why I do this.
For Medical Insight, I'm Louis St. George.
To learn more about this and other health topics, visit essentiahealth.org/medicalinsight.